I was from the days when the doctor spoke and the nurse replied and did what the doctor spoke.
I came as quickly as I could.
All right, going quietly.
And so when I heard that nurses could be something more, I went to the meetings to see what was going on and became a nurse practitioner. I discovered I was illegal during that time, but 20 years later, we nurse practitioners were legal.
Greer says she believes the system will save money and improve preventive health care.
Rather, they begin from a prevention and health promotion focus. They start by giving their patients the information, the care, the advice, and support they need to be healthier.
Today, we see the nurse practitioner scope of practice to be very wide. There really is a buzz about nurse practitioners, not only in Ontario, but across the country. They are the fastest growing nursing category in Canada and will continue to be so for quite some time as the healthcare sector recognizes the value that nurse practitioners can provide to the healthcare system. So I'm extremely optimistic about nurse practitioners in Ontario and in Canada to establish them as the independent providers that they are, and that's a result of the chipping away at those barriers, those scope of practice barriers over time.
The NP plays an integral role in many aspects of the healthcare system. So whether it's in community with kids in hospitals or adults in the hospital, they're very good at reducing the length of hospital stay and preventing readmissions, working full scope in nurse practitioner-led clinics or other primary care practices, working in long-term care, in corrections, all over the healthcare system.
NPAO members work in many of the Alliance members' organizations. So we really appreciate the work of the NPAO in supporting nurse practitioners all over Ontario, some of whom work at community health centers, Indigenous primary health care organizations, family health teams, and of course, nurse practitioner-led clinics.
Working with an NP can help improve the overall care your child receives by combining our medical expertise with a focus on family-centered care. NPs use our ability to independently diagnose and treat patients to provide timely access, health education, continuity of care, and collaboration with other healthcare professionals. Our focus is always on supporting the physical, emotional, and cognitive well-being of our patients and their families.
Homeless Help Peel was started during the COVID pandemic as a way to look after individuals and families experiencing homelessness. And we started with the isolation hotels, and we've evolved since then to run the first of its kind medical shelter, as well as we run outreach clinics in the community looking after unhoused individuals there. Our model focuses very heavily on NP practice, where NPs are the most responsible clinicians for many of the patients, and we are the ones that provide all of the diagnostics and care plans and so on.
Nurse practitioners in acute care are working within specialized programs and have developed clinical expertise in these areas, supported in collaboration with the multidisciplinary team they work within. I see the role of the nurse practitioner expanding and the numbers expanding, especially in critical care areas such as the intensive care units and emergency rooms.
Happy anniversary to the NPAO. Thank you for leading the movement and moving the NP profession forward. And we're looking forward to working with you for many years to move the NPLC clinics forward as well. Happy anniversary.
Happy 50th anniversary NPAO from all of us at the Ingersoll Nurse Practitioner-Led Clinic.
Happy anniversary NPAO from the NPLCA.
It's my pleasure to congratulate the NPAO on 50 years of organizing, implementing, being a powerhouse politically on behalf of nurse practitioners, and we look forward to many more years of working together with you. Happy anniversary.